Hello and welcome. Let's talk about chronic osteomyelitis. So, what does it mean by chronic osteomyelitis? Chronic osteomyelitis is defined as a severe, persistent and incapacitating infection of bone and bone marrow. Now, this is a radiograph showing osteomyelitis. Causes of chronic osteomyelitis: untreated acute osteomyelitis, post-operative, open fracture, and some diseases like tuberculosis, syphilis, and Garrett's disease. Causative organisms: Mycobacterium tuberculosis, Treponema pallidum, fungal osteomyelitis, and parasitic osteomyelitis. Now, stages of osteomyelitis: stage of inflammation, stage of suppuration, stage of bone necrosis, and stage of resolution. Now, pathogenesis of chronic osteomyelitis: infection at metaphyseal endosteum, which leads to percolation through Haversian system to periosteum, and there is subperiosteal abscess formation. There is lifting of periosteum and the ischemia and suppurative necrosis of bone. And there is segmental bone necrosis with formation of the piece of the dead bone known as Sequestrum, formation of soft tissue abscess, rupture of abscess through periosteum, and formation of draining sinus. Clinical features: symptoms include it may remain quiescent for months or years, but from time to time acute or subacute exacerbations occur. Recurrent pain, fever, and swelling. Periodic or constant discharge of the pus, often from a pre-existing sinus. Piece of the bone may come through the sinus. Investigations: blood, TCDC, hemoglobin percentage, ESR leukocytes can be done, pus for culture and sensitivity, and X-ray. On X-ray, bone is thickened and shows irregular patchy sclerosis. Sequestrum is seen as a dense loose fragment with irregularly shaped demarcated edges lying within a cavity in the bone. Subperiosteal new bone may be seen as a lamellar pattern. Sinogram may delineate an abscess inside the bone. Treatment: treatment of the exacerbation of the limb includes immobilization of the limb and antibiotic and analgesics. Surgical intervention includes when adequate sequestrum is formed, then dead bone in the form of a sequestrum may be detected by probing a sinus or by radiograph. Antibiotic according to CS reports will be done, deroofing, sequestromy, and suturization and filling the cavity by muscle or soft tissue. In Brodie's abscess, antibiotic, surgical evacuation and curettage of the cavity, packing with cancellous bone chips should be done, or amputation can be done. Now, differential diagnosis of chronic osteomyelitis includes tubercular osteomyelitis, syphilitic osteomyelitis, and actinomycotic osteomyelitis. Complications of chronic osteomyelitis: pathological fracture, persistent discharge of pus, septicemia, septic arthritis, amyloidosis, and development of the squamous cell carcinoma in sinus, and acute flare-up of inflammation. Now, Brodie's abscess. What is Brodie's abscess? A Brodie's abscess is a subacute osteomyelitis which may persist for years before converting to a frank osteomyelitis. Classically, this may present after conversion as a draining abscess extending from the tibia out to the shin. Occasionally, acute osteomyelitis may be contained to a localized area and walled off by a fibrosis and granulation tissue. This is termed as Brodie's abscess. Clinical features include localized pain, often nocturnal, elevated by aspirin. It often mimics the symptoms of the osteoma, which is typically lesser than 1 cm in diameter. The most frequent sites of Brodie's abscess includes distal tibia, proximal tibia, distal femur, and proximal or distal fibia, and distal radius. Radiographic features: oval, elliptical, or serpentine radiolucency, usually more than 1 cm, surrounded by a heavily reactive sclerosis and granulation tissue, and a nidus often less than 1 cm is seen. Osteoblastoma may be a classic sign for Brodie's abscess. Now, treatment includes surgical approach with antibiotic, surgical evacuation, and curettage of the cavity, and packing with the cancellous bone chips. Sequestrum. Sequestrum is a piece of the dead bone within a living bone. Formation includes bacteria in the circulation, leading to lodgement of the bacteria in the metaphyseal region, and there is proliferation of the bacteria with subsequent inflammation and edema. And there is increased intraosseous pressure within a rigid trabecular cavity, and there is destruction and thrombosis of the vessels and decreased local blood flow, and there is necrosis of the involved area, and pus and inflammatory aggregates spread peripherally through the thin cortex to come beneath the periosteum, and there is elevation of the periosteum leading to tearing of the vessels and further necrosis of the bone, and the bone becomes more devascularized, and there is separation of the necrosed bone and formation of sequestrum. Investigation includes X-ray of the affected part, and the treatment includes sequestrectomy and suturization and filling the cavity by antibiotics according to CS, and splintage to immobilize the part until healing occurs. End of the topic.